Let's first remove any confusion by stating that hormonal therapy should not be confused with hormone replacement therapy, or HRT. HRT is medication containing one or more female hormones like estrogen or progesterone, which is given to women to treat the symptoms of menopause, such as hot flashes, vaginal dryness, mood swings, and sleep disorders. Hormonal therapy, on the other hand, is a systemic treatment prescribed to help lower the risk of cancer returning and to help keep the cancer from spreading to other parts of the body by interfering with the potentially harmful effects of the hormone estrogen on certain cancer cells. Our bodies naturally produce hormones, which are proteins needed for everyday body functions, but in some cases, our hormones work against us. Specifically, the female hormone estrogen has been found to feed some breast cancer tumors, helping them to grow and spread. These breast cancers are known as hormone-dependent, estrogen-dependent, or estrogen receptor positive. We perform a test to determine if your breast cancer is estrogen receptor positive or estrogen receptor negative. We may then prescribe a hormonal therapy that prevents estrogen from acting as a tumor growth factor by either blocking estrogen from reaching your cancer cells or by inhibiting or slowing the production of estrogen in your body. Approximately 75% of all breast cancers are diagnosed as estrogen receptor positive and contain protein molecules called estrogen receptors. When no estrogen is present, these receptors remain inactive. When estrogen receptors are exposed to estrogen, however, they trigger a chain of events that may result in tumor cell growth and multiplication. In the presence of estrogen, these cancer cells may grow and divide, while in the absence of estrogen, these cancer cells may starve and fail to grow. Postmenopausal women may think that because their ovaries no longer produce estrogen, that they are at a reduced risk. But while your ovaries are no longer producing estrogen, your adrenal glands, which are two small glands that sit on top of your kidneys, are hard at work producing hormones called androgens. When androgens meet up with a special enzyme found in your muscle and fat tissue called aromatase, it becomes estrogen. Simply put, aromatase converts androgens into estrogen, which can then react with your cancer and fuel growth. If we can block aromatase from converting androgens into estrogen, we can hopefully starve your cancer cells and keep them from growing. That is the task of aromatase inhibitors. They work by attaching to aromatase, which then stops the conversion of androgens into estrogen. With less estrogen in your body, less estrogen can reach your breast cancer cells, and in essence, this starves your cancer. Tamoxifen, introduced in the 1970s, is a drug known as an anti-estrogen. It works by attaching to estrogen receptors in cancer cells, which then blocks estrogen from attaching and fueling growth. Tamoxifen was a major breakthrough in the treatment of breast cancer. Unfortunately, research shows that after 5 years, tamoxifen is no longer effective because in many cases, cancer cells become resistant to it. Newer hormonal therapies called aromatase inhibitors actually decrease the amount of estrogen made in the body. Femara is an aromatase inhibitor. The next few chapters discuss Femara in detail and answer your most frequently asked questions. You will also learn about the healthy living choices you can make today to help you live your life to the fullest.